Very glad to be here, and I thank all of you for joining us for this discussion about the ways to prevent gun violence. We've got people from widely different sectors of the world who are going to join me in trying to figure out how we can learn from each other about ways to prevent gun violence. I'm going to start by asking each of you, Pastor Mike and Chuck Ramsey and Ed Skyler, to talk a little bit about, introduce yourself and share with us the work that you're doing around gun violence prevention in particular. Let's start with you, Pastor Mike.
Well, it's great to be with everyone. My name is Michael McBride. I am the National Director of the Live Free Network, a national network of organizations, individuals directly impacted by gun violence, both at the interruption level, former individuals who are perpetrators and victims, all working together to scale up peacemaking strategies across the country. We are in about 20 cities across the country and a part of a national Black-Brown Peace Consortium that has been spearheading the securing of about $5 billion from this administration and the Congress to scale up public health, proven community violence interventions. So it's great to be here with everyone, and thanks for having me.
Okay. Ed Skyler, good to see you as well.
Thanks, Errol. Thanks for having me. So my name is Ed Skyler. I am the head of public affairs at Citi, and I help develop what we call our commercial firearms policy, which focused on doing business with retailers that have common sense gun policies. Before that, I was deputy mayor for operations in New York City and worked very closely with our criminal justice coordinator and our police departments. I have a lot of firsthand experience with this very serious issue, and I'm happy to be here to talk about it with you.
Okay, and Chief Ramsey.
Thank you, Errol. Currently, I'm the founding partner of a company called 21st Century Policing Solutions. My background is in policing, starting in my hometown of Chicago, where I spent 30 years as a member of the Chicago Police Department. I then left there and came to Washington, D.C., where I served 9 years as police chief in Washington, D.C., retired very briefly, but still had the itch to get back into public service. And I took over the Philadelphia Police Department, where I served as police commissioner for 8 years. And currently, I am working with police departments across the country on issues of police reform and dealing with crime and violence, and particularly issue of gun crime that's occurring, unfortunately, in many of our cities across the country at an alarming rate. And I'm glad to be here. Thank you.
Commissioner, I want to start with you. There is a national conversation about the future of policing. Sometimes it's called defund, but really what people are talking about is unbundling some of the responsibilities police departments have and maybe putting them in other places. What are some responsibilities when it comes to gun violence prevention that you think maybe don't belong in a police department but could be shouldered by other sectors?
Well, as far as gun violence specifically goes, much of that is going to fall on either local or federal police. I just attended a meeting of alcohol, tobacco, and firearm supervisors here in Philadelphia, and we talked about issues, especially straw purchasing, for an example. This rise in what's called ghost guns that we're finding on the streets, things of that nature. Obviously, that's something that is beyond just, dealing with at a local level. Some of it has to be done at a federal level. But as far as the unbundling some of the issues in policing, certainly people usually point to very key areas like mental health, for an example, homelessness, substance abuse. Over the years, police have been given these responsibilities simply because cities have underfunded social services for decades, and there's no one else available Friday morning at 3 a.m. To handle it other than police. And we are not the right people in all circumstances to be first responders. There are some cases where we should be there, but there are many cases that would be better handled by someone other than police.
Can you say a word more about ghost guns? I was reading about some busts here in New York City that really just terrified me. I mean, the fact that you've got people now ordering these kits online and setting up their own shops in apartment buildings is really quite something. And quite a number of violent crimes here in the city have been traced now to these untraceable guns.
Yeah, if they buy them as a kit and if they're only 80% put together, completed, they don't need a serial number. And the remaining parts, like the barrel and so forth, the trigger housing, those things are added to the gun. And of course, then it's not traceable because there's no serial number. And that's essentially a ghost gun. 3D printing is something that some people are experimenting with, but my understanding is that it's not real effective because it's just unable to really, over time, deal with the pressure when a bullet discharges, the gas expansion. But eventually that's going to be a problem as well. But ghost guns, we're recovering more and more here in Philly. I think they've gotten about 500 so far this year off the street.
Oh, okay, something to be concerned about. And Skyler, you talked about what Citi is doing or can do. You have a particular relationship to, as a bank, to many different sectors. But talk more broadly about the corporate community. What's the motivation for them to engage on this issue, and what are some of the most likely ways they can be effective?
Sure. So I think when you think about it from a banking perspective, a big part of banking is risk management. And when we looked after the shootings in Las Vegas, at Pulse nightclub, in Parkland, all three which affected our colleagues, because we have people that work in those cities, we thought from a risk management perspective, we needed to develop a policy, just like we have policies in other sectors. And on a more personal level, as members of the management team reached out to people who'd been impacted directly by gun violence through those tragedies, one question came back, which was, well, where do we stand on this issue? What are we doing about it? And we don't feel it's our role to take the place of government. But at the same time, as far as the clients that we work with, that we lend to or provide financial services, thought it was pretty important that we had a set of practices that made sense for us. So we looked at some of the best practices that retailers use, as far as requiring only selling to people that pass background checks, only selling to those that are either 21 or older or have gone through some type of training, or police officers or military, and those that didn't sell bump stocks or high capacity magazines. And we thought those were pretty reasonable best practices that, when you look at the data out there, Americans on a bipartisan basis support. 85% of Americans support expanding background checks. Raising the minimum age of 21 has the support of about 80% of Americans as well, and there's almost unanimous support for restrictions on high-capacity magazines and bump stock restrictions. So, to us, these felt like very common sense, measures. But we had to do what was right for us as a bank, and other companies have to make their own decisions. We are not proselytizing about it and lecturing other people. We just had to, given what we experienced and given the need as a bank to have prudent risk management practices, we thought this policy was very reasonable.
And without proselytizing to other businesses,
sorry for pushing the word.
What has the conversation been like internally? I know that when it comes to hiring and promoting and attracting new talent, people want to know about corporate culture and about corporate values. Is this part of that conversation?
It is, because when people are making decisions about where they want to work, and people are making decisions about where they want, who they want to do business with, and what you've seen over recent years is a greater percentage of people. Unfortunately, with the corresponding lack of confidence in government to solve issues, there's increased pressure on companies in the private sector to address some of the issues they see in society, and even more so, the numbers are even higher when you look at the percentage of people who believe the company they work at should engage in these issues. And we have to be very selective about that, because there are people on all sides of every issue, and we have an organization of 70,000 people in the U.S. and 200,000 people internationally. But I think because the way we approached this was based on the data, based on best practices, based on policies that people supported on a bipartisan basis, it wasn't really controversial. It all seemed like it made sense.
Mm-hmm. Okay. And now, Reverend McBride, you've been a national leader on this issue for a long, long time. What are some of the most effective sort of cross-sector partnerships that you've seen? Which ones work? Which ones do you want to see more of?
Well, the great thing about this moment, particularly in the movement to address gun violence in Black and brown neighborhoods, is we don't have to start from scratch. It has been heartbreaking for many of us who've been doing this work for decades to see after many years of a decline in gun-related shootings and homicides in many of our cities, this uptick in the era of this pandemic. And so what we know is that collaboration is the silver bullet. We have to continue to reimagine the way we respond to the worst conditions of our communities. We think that public health-driven strategies allow us all to come to the table using not just science, but the expertise of those individuals in our communities who have proximity to not just the offenders, the firearm offenders, but also to the victims and the families in the neighborhoods. We have a whole menu of community violence interventions that thankfully have started to really capture the political imagination from the White House all the way down to mayors, all the way down to hospitals, all the way down to the streets. The key for us is to trust the expertise. I appreciate the focus on the supply side of conversation around how do we reduce the availability of these weapons, but we must also invest in the demand side, right? The kind of desperation, the anger, the fear, and the pain that this pandemic has unleashed in a very fragile ecosystem of families that, as chiefs have said, are vastly under-resourced to deal with mental health, to deal with the economic instability. This is not to excuse the violent behavior, but I do believe if we're talking about solutions, you must understand the problem and not just use solutions that may sound good in political spaces and or may even make people feel better, but not actually solve the problem. And so I think our work is really about literally evangelizing, every pun intended, right? These strategies to the general public so folks can know we don't have to live in communities that are overrun by this violence without strategies, public health strategies in particular, that can reduce them.
So if someone's watching this and they want to know more about a city that seems to have gotten a hold of this or made some progress or shown some promise, where would you point them to and why?
Well, I will point them to a number of cities, particularly over the last several years. This pandemic, obviously, we think is quite an outlier, although it is a devastating outlier. But we think places like Oakland, Chicago, Newark, New Jersey, Camden, New Jersey, these cities have had a very interesting ecosystem that has been built between outreach workers, between interrupters, between community policing and law enforcement partners, between hospitals, between mental health professionals, between Big Mom and them in the neighborhood, Pookie and Ray Ray. It is an ecosystem that is created in these cities that actually target the less than 1% of the individuals who are driving as much as 60% of the gun-related shootings and homicides. That percentage is still holding quite significantly, even in these upticks, which means that we cannot revert to a collective punishment model while we're trying to address the still small sliver of individuals who are given over to their desperation, their anger, their fear, and their pain. We must continue to look to these cities, see how they are adjusting literally on the fly with very little resources, but still pulling the imagination and the genius from those individuals in communities, in the agencies, et cetera, and begin to continue to model some responses that with the now new federal investments of $5 billion, hopefully, the executive orders of the president to put more administration dollars from departments into cities, the American Rescue Plan dollars coming into cities. We now have more resources than ever if we can trust the strategies, trust the people there, and build an ecosystem of peacemaking, violence prevention, and healing. These cities and others are actually doing this work. We ought not turn away from their wonderful example and experience.
Okay. Now, Chief Ramsey, my father actually was in law enforcement. He retired as an inspector. Got a sister who was a detective. Think back to yourself as a young man joining the Chicago Police Department, and I guess talk to today's young recruits about what policing is now, because it's very different than it was when you got on the job, right? I mean, if we're talking about prevention, we're talking about something fundamentally different than the sort of, thin blue line warrior cops that a lot of young men and women were raised on.
Yeah, policing has changed quite a bit over the decades. I mean, I started as a police cadet in 1968, became a sworn member of Chicago in 71. So you can only imagine that long ago what policing looked like. I remember leaving roll call with a flashlight and a nightstick, and that was pretty much my equipment, a pair of handcuffs. Now, they've got all kinds of equipment that they have to learn how to master, computers and cars. The job has just become far more complex. And also, the expectations on part of the public and what they expect from their police has changed quite a bit, and rightfully so. I mean, people demand the very best. They demand to be treated respectfully. They demand constitutional policing. I mean, these are the kinds of things that, people weren't as aware of some of the things that took place in many neighborhoods simply because they didn't have 24-hour news, you didn't have video of all these incidents, you didn't have any of that. So the demands are great on police officers today, the young men and women who are joining policing, but it's also a great opportunity for real significant change. Now, over the years, police have picked up other jobs. For an example, we've talked about mental health. We talked about issues around homelessness, substance abuse. We always had to deal with that to a degree, but not to the extent we do now. But the one area, though, I know I need to speed up a little bit here, is the kind of violence taking place on the street, the kind of weapons that you get on the street. Back in my day, we used to get something that used to be called a Saturday night special that would be taken off the street. That was a 22 caliber, 32 caliber, usually a revolver, could be an automatic that could hold 7 or 8 rounds. That was it. Now you're getting high-powered assault rifles, 9 millimeters. It's been decades since I've even seen anything that even remotely resembles a Saturday night special. And part of the problem we have is that people are being shot multiple times now, and they literally bleed out on the street. It's so bad that in Philadelphia, they don't wait for an ambulance anymore. We started something where you put them in the back of the patrol car, get them to the hospital, because we have great trauma centers here. And if they can save them, they'll save them. But we don't wait for an ambulance. That's how bad it is. And so that's something we didn't have to face when I was a young cop, but they face it now every day.
Wow. And Skyler, let's talk about the healthcare industry. What role should they play in gun violence prevention?
Well, I think it's more than just the healthcare industry. It's the social services community in general. One thing that we had tried in New York City, and I'm not sure the experiment worked or not, but when Mayor Bloomer was organizing which agencies should be in what portfolio, he actually pulled the corrections department out of sort of the operations portfolio and put it in the health and human services portfolio, because he wanted the young men and women in the corrections system to have support and get the services they need, so that this would be their only time they were in the system. And obviously there's been a whole host of challenges with the jail system in New York City, but I think that type of approach is important, because listen, police officers are trying to protect. They're not. We talked about the fact that they're not necessarily. To say they're not social workers is not to say they're not trying to help society. It's they're not equipped for that. And there's incredible demands on them as they're out, on patrol. And it is, as municipal services in a lot of places have been scaled back, the burden on police officers has increased. And it is, and you can see that strain. And it's, for example, in the police department in New York City, if there's somebody on the homeless issue, which has become so apparent to people, and street homelessness in particular, people are okay, we'll call the police. Well, what's the outcome? Granted, so you move the problem into the back of the car, and then maybe the person has a warrant out or whatever, but really you're not really solving anything. You're just sort of recycling. So social services does need to be evolved, and you need to make sure those resources are allocated.
Yeah, go ahead.
I was just going to add a little something to what Ed just said. Police aren't official social workers in terms of being licensed or certified or what have you, but that's a big part of what police do, and that's fine. I was always proud that this job is all about people. Now, we need better training in certain areas, and we shouldn't be the first responders necessarily in many of these instances, but we're going to come across these things whether we want to or not. I don't believe that the issue is to be completely removed from some of these issues. I don't think that's even possible. But what are the other support mechanisms that need to be in place? You could have a person going through a mental health crisis that could be quite violent. You need police to be there. But in many instances, that's not the case. And if we had adequate staffing of mental health professionals that would be available at 3 a.m. on a Friday morning to respond, to make sure a person's on their meds and doing the kinds of things they need to do, then it never rises to a 911 call. And so These are the kinds of things that we have to really think about and properly prepare officers, as well as building the other network that needs to be there.
And therein lies the rub, right? Because I think for many of us in the community, we believe that this country has overinvested, not just in the profession of policing, but in the presence of policing at the expense of a sector that we know is likely the root cause of why such despair, mental illness, and the manifestation of that is overflowing right now in this moment. If we fund peace, if we fund healing, if we take seriously that criminality is not the sole driver of some of the social problems we're having. If we take that seriously, then we could, rather than put 100,000 more cops on the street, maybe we put 50,000 mental health workers, social workers. Can you imagine during the crack cocaine epidemic if we put drug counselors, mental health counselors as a part of the crime bill versus just cops, right? And it does not diminish the need for a public safety solution, but we must begin to ask ourselves, the moments where we've seen reductions have been a robust ecosystem of civilian and mental health and public health sectors participating in a targeted manner with those who are most vulnerable. We have the models and we have the wisdom of that, but what we have never had are the federal resources to scale it. And I will say to you that we have people in cities all across the country, in your city right now, wherever you are, who are willing to wake up every day and work on healing the hurt of people in their communities. We ought not ask them to do it as a volunteer. We ought not ask them to do it with a slave wage. We ought to robustly hire these individuals as city workers, nonprofit workers, and even some non-civilian in certain law enforcement spaces where they have the space to do that. But we ought to fund peace and healing, particularly in Black and brown communities, and not allow the immediacy of the violence to push us away from that which we know can save lives and make the law enforcement individuals in the communities even more safe and not having to deal with so much that they are not really prepared to deal with in these moments.
Yeah, I'd also add that we've seen a real sad trend, especially here in New York, of police officers and suicides. I think we also have to recognize the mental toll that many of them have carried between the pandemic, between the aftermath of the murder of George Floyd and the reckoning the country has gone through. And some of that lands at their feet, and some have not have made choices that we all regret and grieve over as a consequence. So this is a tough issue, and
Well, it sounds like, because you're talking about a healthcare industry that's devoted to healing, that has the mental health resources and the understanding. That has, frankly, Pastor Mike, as a result of the pandemic, a new cultural status, a new awareness of the linkage between federal funding and the need to organize a local public health response. Mm-hmm. It seems in some ways like we might be poised for some kind of a takeoff into a new environment.
Well, the devil's always in the details, and it's still early, but I'm hopeful, right? I mean, I do think we have a unique opportunity, but we must also realize that the pandemic has brought a level of skepticism around both science and health and the administration of that in communities. It has also created a dynamic where the fracturing and the fragmentation of institutions in Black and brown under-resourced communities has broken through in a way where we may be at risk for profiteering of the nonprofit industrial complex, of even corporations, of even systems, putting Black and brown folks in mid-management roles while largely white folks still sit at the tops without the cultural competency or the proximity to the solutions. So even in this moment, we must prioritize making sure that if disproportionate impact is in Black and brown communities, then the leadership of these solutions must be driven by those very same Black and brown folks and leaders, and allow folks to be solutions in their own communities and not have to respond to the anxieties of well-meaning folks who just may not always have the ability in real time to implement, scale, evaluate, and deliver quality service. I'm hopeful for the moment, but it is still very much a precarious time. Our decisions in the future, immediate future, will determine the success of what we do.
Okay, now that hopeful note brings us to the end of our time. I want to thank all of you, Michael McBride and Chuck Ramsey and Ed Skyler, for a spirited and informative discussion. I hope when we talk again next year, we'll have better news, but right now I think you've really illuminated a lot of important issues for us, and we thank you. Thanks so much.
Thank you.
Thank you.